In general, when we think about, and this is true of most musculoskeletal care, we always think of the multiple reasons for symptoms. There's mechanical injury, which is by far the most common reason somebody would call to come into the office or show up in an emergency room is twisted my ankle, I got angry and punched a door. There's a mechanical injury. There's a mechanism, there's a point of tenderness, there's a study, there's the exam. It's a fairly logical thing. I did something to myself. Can you tell me what it is? Do I need to worry about this? Is it going to heal? Do I need an operation or just a cast? Those are the most common things. But that's not the only reason to have musculoskeletal pain. If you go down the list, there are metabolic reasons to have musculoskeletal pain. There are infectious reasons, a very common thing in my practice. A diabetic, they didn't do anything to anybody. They come in because they hurt. They took their shoe off and their foot smells. Well, that hurts. It's a musculoskeletal symptom, most assuredly not related to trauma. It's an infectious source of symptoms. We see a lot of neuropathic sources of pain, people who have either a neuropathic deformity post-stroke, sometimes even diabetic, sometimes idiopathic, i.e. we have no idea why they have nerve damage, spinal cord injuries. They hurt. They have deformities, malignancies, neoplastic sources of pain. One of the most common reasons that people want to get seen for their musculoskeletal pains is to make sure they don't have a tumor. That's the first thing we knock off the list if you don't have a known history of trauma. And heck, even sometimes with a known history of trauma, we'll see the incidentaloma. We get an x-ray because somebody, hurt their hand, and sure enough, you see something else on the x-ray that's very worrisome, and thank heavens they came in for that. For the most common causes in an orthopedic practice are traumatic, but also the degenerative or acquired. In the foot and ankle, the mechanics are very straightforward. We talk about the concept of the medial column. And I would say more times than not, when someone says, well, I've had pain for the last 4 months. Okay, did something happen? Nope. Woke up, it started hurting, and it continues to hurt. The vast majority of the symptoms in the foot and ankle can be related to the mechanics of the foot and ankle and really wear and tear changes that happen with time. It's kind of the ravages of time and gravity. The foot, the human foot in particular, is a very unique structure. It's not overly complex when you pull the anatomy apart, and the foot will fall apart, collapse, or degrade in very predictable patterns. While there's several and the individual manifestations of those patterns are sometimes different, the patterns are the same. And again, we call this the medial column concept. This is your education in foot and ankle care. Basically, if you think about it, the foot turns into a hand. The difference between the foot and the hand is that the thumb is very mobile, second and third rays are solid as a rock, 4 and 5 are mobile. These are accommodations. The difference between the thumb and the big toe is those series of joints on the, quote, medial column are stiff and strong and are powerful for push-off. They're planar to the earth. They're perpendicular to the earth. They have no natural stability. The more you push off 10,000 steps a day over a period of years, a lifetime, those ligaments will become lax. The mechanical properties of the first metatarsal medial column will fail. Load is transferred to the more stable second and third rays. The manifestation of that is the arch will collapse, the plantar fascia will stretch, the breakdown points are fairly predictable, the Achilles will tighten, and you're going to get arthritis in different locations. Individual pain, individual symptoms can be easily attributed to where someone is on that spectrum, regardless of how they live their life.